can you tell which answer is from the AI and which answer is from human when you just give in the score?
Yes, I can.
Yes.
Oh, you can. So how can you do that?
I can too, because you would notice so many drugs listing every drug for most of the symptoms or the pathology. But whereas for the doctors, they will be limited to a few drugs relating to the disease and its complications. I guess some of them.
Okay.
So I think, to me, I think two very important points came up that make it easy to decipher who's the AI and who are the doctors. So number one is the speed. So the AI is the speed. So the AI is so well trained that the speed is no longer an issue for its brain versus the human brain. I think the second point is the comprehensiveness. I think the AI is so well trained that you can scan and then cover all grounds, whereby the human brain, if you are not careful, certain points may be missed out. So you can see very clearly the comprehensiveness of the report from the AI versus the human brain. I mean, obviously the top quality brain can probably cover as much as the AI, but I think on a very consistent basis, once you are tired, I think things may fall off. Yeah.
Well,
Dr. Mo, you are quite right, because you could notice that the AI would pick out little things and then list them, whereas for the doctors, they confuse them. And even with the diagnosis, you could see the diagnosis that the AI would have come straight to what they think, but the doctors will be adding so many other things. They've already told you that the uric acid is increased. So you come and tell me again that the uric acid is increased. So it doesn't make sense.
Well, hearing the judges saying that make me feel worried about the human competitors, to be honest. It seems like AI have the perfect answers, but the humans, they have flaws. That's how you tell the difference. We think
maybe you can allow me to make one more point. I think the saving grace for the human race is when it comes to the therapeutic decisions. So as the cases get more complex, I think the human brain need to come in to contextualize the case. So I think for certain cases, the AI may not be able to make the best clinical treatment decisions. So I think at this therapeutic front, I think the human touch of the human brain will still need to come in to take into consideration. So this is how I feel in terms of the therapeutic decision.
And he's right. He's also right. This is Jean-Claude. He's also right, because when you look at the answers, the AI, which I suspect, will be listing so many things and not looking the total human being in terms of total treatment. They just list to manage all what they have seen, but the human beings start talking about other things,
Okay, that makes me feel better for the humans. So the result is not that obvious. We're still waiting for the final result to come up. So talking about the difference between the human answers and the AI answers, so which is the hardest part for the competitors?
I think to me is the final section, whereby the sort of the follow-up decisions. I think you can see the AI, because it's trained in such a way that it will cover all the grounds. So it's a very comprehensive step-by-step, although there's a lot of repetition. So you can see the same statement come out for every case or so. Whereas the human mind thinks differently. There are some contestants whereby they are very comprehensive in its plan, whereas some is a bit more concise and miss out certain requirements. But it doesn't mean that they do not know the treatment plan. Is perhaps in this situation, they just list out the more important one, but the AI obviously will list out the 10 treatment decision that is required.
And then you can see the human stress in some of those answers. You can get the stress factor whereas the AI, if you look at it, you will look at it's a bit systematic. The answers are very systematic.
Correct.
And then when you look at the last sector about what you would do, the follow-up, the AI just lists the things that, they say this patient has this, you have to do, this one has this. But the human brain, you start seeing that they don't know about referring for diabetes education. AI will tell you 150 minutes of sports, physical activity every week. the human mind will say increase physical activity, you know, because the AI knows that it's 150 minutes per week. So they put it in. It was interesting, actually.
So kind of the AI just write down everything that's written on the guideline.
Yes,
and the human doctor
exactly.
get messed up in the head. And sometimes to the
Yeah.
end of the case, they don't know what to write.